Hello, everyone, and welcome to Mama Talks. My name is Erin Esteves, aka OG Mamacita. That's officially geriatric. Thank you very much. I am here tonight with the oh-so-patient Dr. Philip Goshensky. Hey, Dr. G. And my partner in crime, Miss Mary Jane Fisher of All Things Crunchy. Hello. So thank you for joining me. I'm terribly sorry about the entire technical difficulty situation beforehand, but we made it. We're through, and we're better for it. At least that's what I'm going to tell myself. I'm a better person now than I was an hour ago. So today I'm really excited and kind of nervous to broach this topic because it is such a hot and volatile topic. So I was really pleased when MJ introduced me to Dr. Goshensky because he really kind of was a sound voice in a chaotic cacophony around me. Let me introduce everyone to Dr. Philip Goshensky, who will be talking to us tonight on the topic of immunizations and vaccines. Hello, I'm going to call you Dr. G because I know I'm just going to slaughter your name.
You're doing great so far, Anna. Better than most people.
Oh, why, thank you.
That's true.
So, you know, I was really apprehensive, like I said, about finding the right person to talk about this because, like I said, people are, it inflames people like almost instantaneously the moment you talk about vaccines, particularly in this day and age here in Southern California, where we have a lot of bills and rallies and protests and some outbreaks and just a lot of mob mentality, a lot of fear-mongering. So I want to, without further ado, read from your website on your bio because I think that your credentials are extraordinarily important in this conversation so that people know that that you're not just pulling the stuff out of the air, that all of these statements that you are making are based on years of experience, research, and hands-on learning, and I don't want to say experimentation, but more manifestation of the use of immunizations. So let me go ahead and give that a quick read. So Dr. Philip J. Goshensky, MD, is a pediatric infectious disease specialist with a 45-year career in clinical and academic medicine. He received his undergraduate degree from the University of Arizona, Tucson, and his medical degree from the New Jersey College of Medicine and Dentistry. He is a diplomat of the American Board of Pediatrics and a fellow of the American Academy of Pediatrics. You also reached the rank of captain in the United States Navy Medical Corps and closed your military career as head of the Infectious Disease Branch, the Department of Pediatrics, Naval Regional Medical Center in San Diego, California. And you also served as assistant chairman of the Department of Pediatrics. So you've got a lot of knowledge, and as they say in Spanish, you've burned your eyelashes with study in this topic. So I really appreciate that, and thank you again. And pretty much I'm going to hand the reins over to you because you have this phenomenal presentation that you gave MJ and I a couple of weeks ago that really concreted a lot of points. So without further ado, I will be your tech assistant and listen for the ding to pass on to the next slide, Dr. G. The floor is yours.
Okay, well, thank you very much, Erin. I appreciate that introduction. And to start off with, I would like to make a comment about what you said about the kinds of responses we're seeing, especially through California, on the matter of vaccines. I think we have to separate out one issue that's just in the very recent couple of weeks, as the California legislature has been forwarding this bill to reduce the exemptions that are possible for vaccines. In other words, parents cannot opt out as easily as they did. That's really a separate issue. And I like to separate that from what I'm going to talk about, which is the hard science behind immunizations. So why don't we go ahead and start with that. And let's go to the first slide, which is why vaccines fail. And there are several reasons for that. If we can go to that first slide. Do I have to click on that?
Did it not come up for you? Why vaccines fail? Oh.
It's still the small image at the bottom.
Okay, so yeah, put your mouse over the PowerPoint presentation on the film strip on the bottom,
Okay.
and then click on that. It should bring it up.
Fine, we're home.
Okay.
Now, one of the reasons why vaccines don't always work, and there really isn't anything in medicine that always works, but there are several reasons that we can look at why vaccines don't do what they're supposed to do. Is one that is that some children simply are unable to manufacture adequate antibodies when they're given the vaccine. If they are exposed to the actual live natural virus, it often means that they don't survive that infection. And you may remember the bubble boy, for instance, in Texas, a child who was born with what's called severe combined immunodeficiency, and he could not handle infectious agents at all. And that's one of the barriers. Now, some people have only a partial immune deficiency, and they get along in life pretty well, but sometimes they just don't form antibodies. Line shows that we're talking about maternal antibody, and that refers to the kind of situation that we see in measles, for instance. If a woman has natural measles during her younger life, when she is pregnant, she transfers some of that protection, the protective antibodies, to her child. And if that baby is given a measles vaccine before the first birthday, for instance, the antibodies that he or she has received from the mother interfere with the vaccine so that the vaccine doesn't work. This is why we wait until 12 to 15 months before we give the measles vaccine to children these days. Another group of patients is those who are on medications such as steroids. Steroids are wonderful medications. They are truly life-saving in many cases. However, they do sometimes interfere with the immune response, and the patients who are on steroids sometimes don't respond to vaccines as they ought to, and that leaves them susceptible. The next group is those who are in countries where the delivery systems are not adequate, and that refers to what we call the cold chain. You can certainly imagine in a country like Africa where technology, can go back as lacking, vaccines that require refrigeration are allowed to come to the ambient temperature, then that vaccine is inactivated. We have even seen that here in the United States, where when the vaccine for measles was being stored in offices in the door of the refrigerator, instead of being farther back on the shelf of the refrigerator, the temperature in that vaccine vial was high enough to inactivate the vaccine, and that was responsible for some failures. There are some failures that are really tragic, and if we can advance to the vaccine tragedies, we have to admit that there have been some terrible misfortunes when we use vaccines. One of the earliest occurred with the vaccine, which was contaminated with the Staphylococcus bacterium, and the result of that was we lost 10 babies in that process. Another one was the Lubeck disaster, occurred in 1930, where children were being vaccinated against tuberculosis, which was a terrible scourge in the 18th, 19th, and early 20th centuries. And there were 72 children who didn't survive because they were infected with an improperly treated deactivated vaccine. Another example was the one that we encountered when we began to use the smallpox vaccine throughout the country. We found that children like the bubble boy that I mentioned earlier, whose immune systems could not handle infections, vaccine to literally take over the host, and those infants sometimes did not survive. Another example was kids with eczema. Eczema is a skin condition which also is a challenge with smallpox vaccine, because we found that when kids with eczema are given the small vaccine, they develop a condition called eczema vaccinatum, which is a generalized rash which involves the entire body, which means that the virus has spread throughout those damaged tissues. And in fact, we soon learned that if a child has a brother or sister at home with eczema, we couldn't vaccinate the child either, lest that vaccine be spread to the eczema-affected brother or sister, and the same disaster would occur.
Oh, sorry, Dr. G, is that what they call shedding? Because I've heard mention of that.
I'm sorry, I didn't get the question.
Is that what they call shedding?
Shedding, yes. The
Okay.
virus that is deposited in the upper arm of the recipient who's getting smallpox vaccine is very active, and we sometimes would see in our office a child would come in with what looks like a smallpox vaccination on the cheek, because if that child had been roughhousing with his brother or sister who had just been vaccinated and pressed his cheek against that area where the vaccine virus was deposited, he would in fact get inoculated with the vaccine virus and end up with a scar on the cheek instead of where it belongs, which is on the shoulder. Does that answer your question?
Yes, it does, and it just astounds me. So
Yes.
go ahead.
So we soon learned that we had to counsel the parents to make sure that the vaccine site was covered for the entire period until that scar formed and it was no longer infectious.
And at what
Another
age?
one.
Sorry, at what age is the smallpox given?
Well, we don't give it anymore, but we used to give
okay.
it at about 1 year of age. And then we would give a booster later on. But generally speaking, smallpox vaccine is good for several decades. And we no longer use it because smallpox is a disease which has simply vanished as a result of very aggressive vaccination programs. One of the tragedies that we encountered, and again, if we can advance the slide, was the Cutter incident. The Cutter company was a manufacturer of polio vaccine, and they failed to adequately inactivate a batch of vaccine. The result was 200 children who received that vaccine were paralyzed, and 10 of them did not survive. And as a result of that, the standards for vaccine production were tightened up very significantly, and we haven't seen that kind of problem since, except that there was a similar incident, not exactly the same mechanism, in Mexico, where several children lost their lives because of improper manufacture of a vaccine. So again, human error can sometimes cause some of these vaccine tragedies. The fact that sometimes there are serious side effects of vaccine made the government come up with a VAERS program, Vaccine Adverse Event Reporting System. And this is a program in which persons who have had an adverse effect from a vaccine can apply to this government program and be compensated if it turns out that the vaccine was at fault. Now, you have to remember that just because an incident is reported to the VAERS system doesn't mean that the vaccine was at fault. Sometimes it's just a coincidence and another infection might have occurred in the meantime. However, that is there to protect people, and there have been some genuine problems resulting from the vaccine, but at least now victims have a way of getting some compensation for that injury. The next slide shows a typical response to a vaccine program. This happens to be a graph depicting what happened when the measles vaccine was licensed in the mid-1960s. If you look on the left side of that graph, you'll see that there were approximately 500,000, if not more, cases of measles every year in the United States. And this goes back to the early 20th century. The vaccine was licensed, as I pointed out, in the mid-60s. And within 2 years of the licensure of the vaccine, measles almost disappeared from the landscape. Now, the reason I want to have you focus on this particular slide is that this pattern is typical for every single vaccine that was licensed before and after the measles vaccine. That within a 2 to 5 year period, we have seen very dramatic changes in the incidence of these infections. And as an example, on this slide, it shows what has happened in the years between the development of a vaccine and the widespread use of it. Before there was a smallpox vaccine available in the early 20th century, for instance, we were seeing nearly 50,000 cases a year of smallpox. If you're a student of history, you know that smallpox was a terrible scourge for about 10 to 12,000 years of recorded history. After smallpox vaccine was introduced, the incidence in 2001 was 0. There were no cases. There have been no cases of smallpox since the 1970s, and therefore the vaccine was 100% effective. If we look at the next one, diphtheria is another example. When the pioneers of this country were headed to the West, one of the terrible scourges that especially affected their young people was diphtheria. Before the vaccine, diphtheria was very common throughout the country, well over 100,000 cases a year. In the year 2001, when this study was done, there were only 2 cases of diphtheria. Again, a virtual 100% reduction.
That's crazy.
Another example of this is polio. I still remember the years when polio was a scourge. When I was in elementary school and high school, polio was very prevalent. There were about 16,000 cases a year during the vaccine era. After the vaccine was developed, there were no cases of paralytic polio. Again, a 100% reduction, which followed the vaccine introduction by only about 2 years. Now, the next slide shows why we have a polio vaccine. And one of the examples that shows how effective it is occurred in Holland in the early 1990s. There was a religious group that did not choose to vaccinate their children against any infectious disease, including polio. And then the results of that was that when polio was introduced from another country, 71 persons from that religious group developed polio. 59% of them were paralyzed, and 2 of them were, unfortunately, did not survive at all. And if we look at what happened in the rest of the country, Next, advance that, please. We find that none of those patients have been vaccinated, whereas throughout Holland, where a vaccine program had been in effect for about 30 to 40 years, we find that there were no cases of polio among vaccinated persons. That's really pretty good evidence that vaccination is effective. Now, let's continue and show some other examples. And if we look, for instance, at measles, measles, as I point out from the earlier slide, occurred among about 500,000 children a year in the United States. If you were growing up when I was a kid, it was virtually impossible to escape measles. In the year 2001, there were only 160 cases of measles in children in this country, a 99% reduction. Another was mumps, and if we look at mumps, we find that there were about 150,000 cases a year. After the mumps vaccine was introduced, again in the 1960s, it dropped down to 266. Now, we tend to think of mumps as being a pretty benign disease, and in fact it is. But when we were unable to control mumps before the vaccine, about 100 to 200 children a year would die of mumps, and tens of thousands would suffer things like mumps meningitis, mumps orchitis, which in males affects the testes. It causes deafness, and we simply don't see those complications anymore because we have an effective vaccine. The next one on this slide is German measles or rubella. Rubella is a very mild disease. There were about 50,000 cases a year before we had the vaccine. There were only 23 cases of rubella in 2001. Again, this followed the introduction of vaccine by about 2 years. But the really important thing about measles is shown on the next slide. And what that shows is the incidence of congenital rubella. Before we had the vaccine, we would lose about 800 babies a year from congenital rubella. Sometimes they would die. Sometimes they would end up with deafness or blindness, severe mental deficiency, or sometimes a combination of all. Someone who I went to high school with had a child with congenital rubella and is now in his 50s and has had to have very close care during his entire life because he is blind, he is deaf, and unable to communicate. The incidence of congenital rubella in 2001 consisted of 3 cases, and each of those cases came from another country, typically from either Central America or the Philippines. One of the most outstanding in my memory, if you could go up to Haemophilus influenzae causes meningitis, causes a number of other problems. It causes joint infection, it causes a severe breathing problem. Typically, there were about 20,000 cases a year of meningitis or epiglottitis due to Haemophilus. After the introduction of the vaccine, again within about 2 to 4 years, that dropped so that in 2001 there were only 181 cases. Let me give you some of my personal experience on that. When I was in my residency in pediatrics, I was at a fairly large hospital on the East Coast. We had about 30 beds. In 2 years during that residency program, there was virtually never a week in which we didn't have at least one child with Haemophilus influenzae meningitis. Wow. Since we have introduced the vaccine, a pediatrician can go through his or her entire period of training and 10 or 15 or 20 years of practice, never see a single case of Haemophilus or H. flu meningitis. Again, pretty striking changes.
So, and just a layman's name for that, is that just what, I mean, because that's a medical term for it, so I can't imagine what I would call that. Is
meningitis?
What, oh, just the meningitis, right, yeah.
Meningitis is an inflammation of the coverings of the brain, what are called the meninges, and sometimes those children did not survive. Oh. It often left them with severe neurological deficiencies, chronic seizure disorder, for instance, inability to attend an ordinary school, etc. Epiglottitis is one of the most severe breathing problems that a child can encounter. Epiglottitis can occur very rapidly, caused by the same germ that causes meningitis, except that it affects the throat. It's possible for a child to be completely normal in the morning and be dead in the afternoon from epiglottitis. It proceeds very quickly. It threw all of us into a panic whenever one of these kids came into the emergency room because we knew that we may have only minutes to save that child's life. This is a disease that simply has vanished from the pediatric landscape after the introduction of the Propolis vaccine.
That's amazing. That's amazing.
The next one is pertussis. Pertussis is kind of a problem. Pertussis is another name for a whooping cough. There were well over 100,000 cases a year before we developed the vaccine, which goes back to the 1930s. After the vaccine, we saw a dramatic reduction in whooping cough, but we didn't see an elimination. And the reason is this. Whooping cough immunization isn't given until the child is at least 6 weeks of age. And it takes 2 to 3 shots of the whooping cough vaccine to provide complete immunity. That means until about 4 to 6 months of age, a child is susceptible to getting whooping cough. And especially if the mother has not been immunized and cannot transfer protection to that child. Now, one of the challenges of the whooping cough or pertussis vaccine is that it's a crummy vaccine in the sense that it caused a lot of side effects. It commonly caused high fever in many other recipients. Sometimes that high fever caused seizures, what are called febrile seizures or febrile convulsions. Sometimes those kids had even more severe problems, sometimes didn't survive. And because of the fact that the pertussis vaccine was such a dirty vaccine and has so many side effects, a couple of decades ago we began to develop something which had fewer components, fewer chemical components within the vaccine. And as a result of that, there were many fewer complications such as febrile seizures or convulsions. The downside is because it didn't contain as many of the stimulating proteins and other substances that produce antibody, the immunity that results from the new vaccine doesn't last as long. This is one of the reasons why we're seeing so many cases of whooping cough throughout the country, especially in teenagers and young adults, because by that time, this less than perfect vaccine has begun to wear off, and unless they're re-immunized, which is now a common practice in college, college admission, then we're seeing young people with whooping cough. About 15 years ago, we saw a lot of whooping cough in San Diego among young adults, often unrecognized because they don't get the kind of terrible symptoms that young infants get, which is the extreme difficulty in breathing. Now, if we go to the next slide, it shows what happens when parents stop vaccinating their children because they're afraid of those side effects. And again, I will admit that the side effects of that old vaccine were quite severe. And there were about 100,000 cases of whooping cough in the United Kingdom in the early 70s. And when the death certificates were examined, the deaths were blamed on pneumonia. And the reason for that is when a child develops whooping cough, they don't die in a couple of days or a couple of weeks. It sometimes takes them a couple of months. And during that time, they have severe breathing difficulty, multiple episodes, like 40 or 50 episodes a day of severe coughing, accompanied by vomiting and really panic reaction in those children. They sometimes bleed into the skin of the upper body because they're coughing is so severe, and pneumonia is so common that they die of pneumonia and not of the original whooping cough germ. So those cases were not coded as pertussis, but as pneumonia. And for that reason, the whooping cough epidemic was simply missed for a long period in England. Now, if we go to another country, which is Japan, in 1974, when they were still immunizing their children against whooping cough, they had less than 400 cases, and no child in Japan died of whooping cough in 1974. But starting in 1975, 1976, parents began to panic because of those side effects. They stopped vaccinating their children. The Japanese then experienced 13,000 cases of whooping cough, and they lost 14 babies who were not being immunized. Now, another example of what happens when parents fail to immunize occurred in Sweden. Same scenario, different time frame, same scenario. In 1981, they only had 700 cases of whooping cough in the country of Sweden. But because Swedish parents were frightened by the stories that they read in the media, they stopped immunizing their children. 4 years later, they had more than 3,000 cases of whooping cough. Probably none of those would have occurred had these kids gotten well immunized. Probably one of the most dramatic examples is in the next slide, which came with the collapse of the Soviet Union. Now, you remember that when the Soviet Union collapsed in 1989, 1990, at that time, there were about 800 cases of diphtheria. However, their public health infrastructure collapsed in the years following, and children were not getting properly immunized. In 1994, only 5 years later, they had 50,000 cases of diphtheria, a disease that had virtually disappeared through all of Europe, and they lost 1,700 children as a result of that. And so in each of these cases, you've seen what happens when parents decide not to immunize their children. So let's see what happens as a result of that vaccine refusal. Now, there are some reasons, and some pretty understandable reasons, why parents don't want to immunize their kids. One is fear of complications. I mean, let's face it, if you have had a child who got the DPT vaccine, diphtheria, pertussis, tetanus vaccine, and had a seizure and had to be hospitalized as a result, when the next child came along, you might want to be somewhat reluctant to use that same vaccine because you worry that maybe your kids are somehow susceptible to those vaccines, and that is a legitimate concern. However, keep in mind what I had to say about pertussis. If you have ever seen a child die of pertussis, you won't fret about a simple seizure, which tends to be without any long-term complications, because the kinds of symptoms and complications you get from diphtheria or pertussis or tetanus can be really frightening. Now, another example, for instance, is that we simply coddle our children. We're seeing so much of that these days. My gosh, the news is full of stories about parents who won't even let their children play in a park a block away from the house because they worry about it so much. And so coddling the child is another reason. Again, that's understandable. I just read an article today about helicopter parents, and that's a term that I used in the 60s and 70s. The parents who just wouldn't take their eyes off the child, wouldn't let the child grow up and gain some independence. But we still see that. Another example, for instance, is the denial of a threat. And I have heard parents say that, why should I get my child immunized against polio? There hasn't been any polio in this country for a couple of decades. And that's true. But what they realize that is not the case in other countries around the world that are not immunizing their children against the diseases like polio. Another example, for instance, is the economy. The economy is something that makes a difference too. Now, let's move on to the concept of Well, we'll talk about vaccine foes in just a little bit. Let's move on to the next slide. We'll talk about the side effects of vaccines. And the fact is that all prescription drugs and all biologic products, and you can move on to the next slide, next line, have side effects. If you go through what's called a physician's desk reference, which is a large encyclopedia-type volume that lists all the prescription drugs that are licensed in this country, every single one has side effects. And as we point out in the next line, vaccines are very complex materials, much more complex than most drugs that are available. So it's inevitable that some individuals are going to react to some component of the vaccine. If we then talk about the concept of a reaction, we have to remember something. If you have a little girl who had a very bad reaction to something like pertussis vaccine, or for instance might have had a rash from measles, or had a cough or fever from measles, something that you have to consider is that reaction may indicate that had that child been infected with a natural virus, that might have been the 1 or 2 children out of 1,000 who died of measles, or the 1 or 2 children out of 1,000 who would get a severe brain inflammation from measles. So what it tells me, if a child has a reaction to the mild vaccine, is that's a child that we protected from dying, because had she or he been infected to the natural virus, more than likely would not have been able to resist that virus. If we look at coddling the child, what we find is something that's very common, that we don't want to inflict pain to our children. And that's natural, that's understandable. And I can understand why people don't want to put their kids through that. But the fact is that sometimes we have to avoid something worse. We have started using combination of vaccines. They have somewhat mitigated the problem. However, we still have to give kids about 40 different vaccines between the time they get their first one and the time they enter school. And although we have a lot of vaccine combinations, it doesn't eliminate the problem completely, but it certainly has made it possible for us to give children a lot fewer needle injections than we had earlier. Now, one of the things that parents have to keep in mind is you don't get a do-over. If a child contracts polio or measles or meningitis or whooping cough, that's it. You can't backtrack that. And one of the best examples we found just in the last few months was what happened when measles was introduced at Disneyland by someone coming from another country. Now, it's true there's almost no measles in this country, but there's a lot of measles in other countries. We're talking about hundreds of thousands of cases in developing countries, and that's what the threat is. It can always be introduced into this country. One of the things that I alluded to was the comment that some parents make that diseases like polio and measles don't exist in the United States anymore. Well, if we look at polio, for instance, there are 3 countries on the planet, Nigeria, Afghanistan, and Pakistan, where the polio vaccine programs have been failures. And the reason is the people in those countries feel that polio vaccine is intended by Western countries to injure their children. They have actually killed the teams that go into vaccine their children. And we are still seeing literally hundreds of cases of polio in those 3 countries. The only places in the world, with a couple of very small exceptions where there are just a handful of cases, where polio still exists and keeps us from eliminating the disease completely, as we have done for smallpox, for instance. If we look at economic factors, I alluded to that a little earlier, vaccines are expensive. I mean, these things are not cheap. What we find is that the average family is going to spend $2,000 to $3,000 from birth through adolescence on vaccines. And for some people, of course, that is a lot. However, when you put this into perspective, you realize that the cost of raising a child, not including the cost of college tuition, is about $250,000. And now all of a sudden, $2,000 or $3,000 doesn't seem like an awful lot. However, for people who do have some economic problems, there is a program called Vaccines for Children. Anybody can Google that, and it's possible to obtain vaccines at no cost for children who meet the criteria. One of the people that we have encountered who is anti-vaccine is Dr. Vera Scheibner. And I'll quote her directly. She says, "There is no evidence whatsoever that vaccines of any kind, but especially those against childhood diseases, are effective in preventing the infectious diseases that they are supposed to prevent." Dr. Scheibner claims that all these diseases have gone away because of public health measures that have improved our overall health. That doesn't explain why starting in the 30s, going through the 40s, the 50s, the 60s, the 70s, and 80s, each of those diseases disappeared only within about 2 years after the vaccine was introduced. If the public health measures were responsible, they should have all disappeared in the 1930s. But the fact is that they did not. And when we look at Dr. Scheibner's credentials, you'll find that she is not a physician or even a biologist. She is a geologist. And she has had sanctions applied against her because of some of her practices. And if you want to Google Dr. Scheibner, you can obtain that information on your own to verify what I've been saying. Now, again, Dr. Scheibner cannot explain why this kind of curve occurs within 2 to 4 years of the introduction of every single vaccine that I have talked about. Now, something to consider is another graph shown on the next slide, which illustrates the changes in the incidence of these diseases over the past century or so. The upper bar graphs show the number of cases of each of these diseases: mumps, hepatitis A, hepatitis B, rubella, smallpox, diphtheria, and these are tens of thousands of cases of these illnesses. If we look at the incidence of these same cases that are shown at the bottom in orange, we find that mumps went from 162,000 cases a year to 2,600. Hepatitis A, hepatitis B have dramatically decreased. It's good to know that the hepatitis vaccine isn't even made from the real virus. It's what's called a recombinant vaccine, and so there's no risk to that, that immunization. Rubella has virtually disappeared. Smallpox and diphtheria have vanished from this country after being around in pretty considerable numbers for several generations. Now, so then you have to ask yourself, is this coincidence? I mean, the argument, for instance, that the infectious diseases decline because of non-vaccine public health measures simply don't hold up. They didn't occur simultaneously, but they all declined by more than 95% within the first 5 years of the release of the vaccine. Now, there's one other issue that is important, and that is the matter of religion. And we have to respect how people feel about their religious faith. And it's a very difficult ethical challenge to tell people that they must vaccinate their children even though their religious tenets show that they should not. But let's see what happens when they follow their religious advice and don't vaccinate their children. In the early 1990s, there was a significant outbreak of measles in Philadelphia, and there were over 1,400 cases. 9 of those children died, and of those 1,400 cases, more than a third belonged to 2 churches whose members refused immunization, and when their kids became sick, they refused to allow them to be hospitalized. And of the 9 children who died, 6 of them were members of those church organizations. And that's a high price to pay for a religious tenant. And one of the people who was interviewed at that time made the comment, and she said, "Jesus is my doctor." Well, Jesus is my doctor too, but sometimes he refers me to a specialist. Now, is it possible that maybe sometimes vaccines work too well? Well, I alluded to this somewhat, in that infants of mothers who have natural immunity to measles are protected for more than a year. And so the infants born to mothers who had vaccine measles instead of natural measles become susceptible to measles by the time they're about 6 months of age. That means that instead of waiting till the child is 12 to 15 months of age, during an outbreak of measles like we have seen in California just in the past few months, children should be vaccinated against measles when they're about 6 months old, because by that time the immunity that they gathered from their mothers has waned, they again become susceptible.
Okay, I see.
Then we come to the legal quagmire, and let's finish up on this topic, because then we come up with the issue of public safety versus personal freedom. And I would agree that there is a need to maintain some personal freedom, but public safety is also a problem when your personal children are the ones that you put at risk, not just the public at large. And when we look at this, the reason for this, there is something called herd immunity. And herd immunity occurs when the great majority of people are immunized against the disease, and therefore the number of susceptibles is very small. And because of the small number of susceptible persons within the community, the likelihood of spread, as we're seeing in California with the measles outbreak, is very much reduced. But when the herd immunity drops, as we see, for instance, in states like Oregon and Washington State, where there are large percentages of people who don't immunize their children, the immune level drops to about the 80 to 85% level, and we have a fairly substantial population of children who are now susceptible. The result of that is we're seeing an enormous outbreak, for instance, of whooping cough, pertussis, in Oregon and especially in Washington because of that. And finally, I want to comment on kids who are unusually susceptible, in whom we do not give the standard vaccines. One is kids with congenital immune disorders. They can't form antibody anyway. We have to give them what's called passive protection by giving them injections, for instance, of gamma globulin when they're exposed, because the antibodies in gamma globulin are likely to protect them. We can do that for measles. We can do that for hepatitis, as an example. Then we have immunosuppressed patients. These are patients who used to be normal, but now they're not, because they may be getting chemotherapy, for instance, which increases the risk of infection, and we have to protect them as well. And then, of course, I alluded to kids who are at risk of pertussis, whooping cough, because they haven't been around long enough to get the first 3 full doses of pertussis vaccine, and until they get that third one, they are still somewhat susceptible to that disease. And for that reason, we have to protect those children. Now, how do we handle this issue of the parents who don't want to have their children vaccinated because of religious reasons or their personal reasons or various concerns? I can only say that those children then should not be allowed to go to school, for instance. Everything has a price, and the price you pay for not immunizing your children is not to allow them to be exposed to areas, to populations that may be circulating the virus. Disneyland is a perfect example, and in that case, I think homeschooling is the answer. I happen to be a very strong advocate of homeschooling anyway, so I think it's easy for me to make that recommendation. And if you have any other comments or questions, I'd be happy to answer them for you.
Thank you. I'm just, I was very quiet throughout the whole thing because there was so much information there, and I was revisiting it after our own conversation a couple of weeks ago. But what I really hope for our followers to appreciate is that I wanted us all to kind of start at the same page, so that we can then present questions that we have to you and have them answered. But at least this way, we're all starting from the same point. So if anything, I hope that our followers take the time to listen and read the slides, and I apologize if there were some flipping and flopping.
That's okay. I do that myself when I'm in control.
So, but for me, a lot of the questions, because I'm just a language geek and kind of geeky in that sense, had more to do with medical terminology and different things like, what the heck is diphtheria?
Ah, okay. I keep forgetting that people your age never even heard of it because the disease doesn't exist anymore. Diphtheria used to be very common. If you read the histories of people who traveled to the West, the pioneers, it's impossible to read one of those stories and not encounter diphtheria. Diphtheria is an infection that's caused by a particular kind of germ. The typical symptoms cause a severe sore throat. However, the diphtheria germ produces a toxin, and the toxin can produce damage to the heart. And so one of the complications of diphtheria is heart damage, and this is one of the reasons people don't survive that disease. So that when we give a vaccine against diphtheria, the vaccine is not directed toward the germ, as it is in a virus,
the effects of the germ,
but to the toxin, the poisonous material that the germ produces. The same is true of tetanus. Tetanus is a germ that occurs every place. It's in our soil. That is, you probably have some tetanus germs in your carpet at the moment as we speak. But the reason that's not a problem is because when you were a kid, you got tetanus immunization, not against the germ, but against the toxin, the poison that the germ produces. Tetanus is also known as lockjaw.
Right.
Tetanus causes a severe disruption of the nervous system, so that when the person is stimulated, like turning on a light in the room or making a noise, the nervous system goes into overload and causes the muscles of the body, throughout the body, to contract. And since the muscles of our jaw are so strong, then the inability to talk or to move or to open your mouth was one of the prominent signs of tetanus. This is why it was called lockjaw.
I actually knew somebody whose dad got lockjaw when I was in high school.
It
was very scary.
So, if we have a few minutes, let me just make a comment about tetanus. During World War II, our troops were immunized against tetanus because it was recognized from World War I that this caused tremendous number of deaths among the military because of contamination of dirt going into war wounds. The Nazis did not, the German army did not immunize their soldiers. Hitler felt that this was an unnecessary expense. The result of that was that the German military went into World War II without the immunization against tetanus, and they lost 200,000 of their soldiers from tetanus. On the other hand, the American forces lost less than 24. Not because the immunization didn't work in our guys, in those 24. Those guys were smart Alex. They decided that they didn't need the vaccine, so they never got the tetanus vaccine. They forged the entry into the immunization record. They were never immunized, and we lost more than 20 of them because they thought they didn't need the tetanus vaccine. 200,000 versus 0
Yeah.
is a pretty significant statistical fact.
The numbers don't lie, that's for sure. The numbers do not lie. Go ahead, Em.
Oh, I was just going to interject with a question, but I want you to finish your thought if you.
No, go for it. I'm good. Thank you.
Well, Dr. Goshinsky, since you were a pediatrician, I mean, I kind of assume you still are, but for such a long time, what are your thoughts of the amount of vaccines that are given to infants, newborn infants, and children like before the age of 2? Any thoughts on the drastic amount of increase?
Yeah, that's a very good question, and I just hate to see kids get needle after needle after needle, and there's no way a 1-year-old or 2-year-old can understand why it's so important. And as a matter of fact, a lot of parents can't understand it either, and I can sympathize with that. Now, it's true that by the time a child gets into the 1st grade, they have received about 40+ immunizations. That is a large load of chemicals in those vaccines. You have to remember something, that the number of chemicals that are introduced into the body with the natural virus is an order of magnitude higher than the number of chemicals that are delivered in a syringe. From a few hundred to tens of thousands. That's the kind of difference. And so even though it looks like we're giving our kids an awful lot of foreign material, that is nothing compared to the foreign material that they get if they happen to sustain one of these infections. And when you consider how small the number of side effects are really when we look at these, the worst ones are the ones we have avoided now because we now use a cleaner pertussis vaccine. Things like measles, mumps, rubella vaccine, poliovirus vaccine have so few side effects, they are of minimal consequence. When it's your kid that gets a seizure, for instance, though, from maybe a measles vaccine, that's a big deal, and I understand that. And as a matter of fact, some of the vaccines have had some side effects. For instance, we no longer give poliovirus vaccine by drops. We no longer give the Sabin vaccine, the oral polio vaccine, because what we found was that some children are so susceptible to that virus that they even got polio from the vaccine virus. So we're back to the original Salk vaccine, which is a killed virus and is given in multiple doses instead of a single dose of the drops that you might have gotten when you were kids.
Okay. So what I can really gather from this, just globally speaking, is that when things go right, vaccines are phenomenal.
Precisely.
When every step in that chain, from the creation of the vaccine to the proper administration of that vaccine, when all of those links are systematically and just very carefully adhered to and followed, and all protocols are carried out, vaccines are phenomenal.
That's exactly right. Let me give you a perspective on that. More children have been killed by passenger airbags in our vehicles in the last 20 years than have died from vaccines. And yet, we wouldn't think of giving up our airbags, let alone our vehicles.
Just from my own personal standpoint, I think that a lot of people who have issues with vaccinations generally have a lot of trust issues with the people that we are supposed to go to for advice. You know, there are some, basically what I'm trying to say is that there are some physicians, some doctors who do not acknowledge the parent's intellect or capability of understanding something, and they just dismiss parents' apprehensions or concerns. And it is unfortunate that when that happens, they just turn away completely. And I'm just speaking generally. I think that is the first step in helping everybody be comfortable with the use of immunizations, because there are some people that you need to find out their patient history. And that just doesn't happen, in my opinion.
That's what you were talking about a little bit ago. You know, if the protocol is followed, if everything in the link of the chain is followed, then it should work out perfectly. But that's the problem that I think that a lot of us parents are falling into, is that either for ourselves or for our children, there's a little the link isn't there, or you know,
can't trust the links. The checks and the balances aren't there. So I don't want to turn this into the conversation now. I want to save more of the discussion for the next episode, where we come back with questions to you for answers, and we're going to be taking questions from social media, from our Facebook groups, Google+, Twitter.
One more comment?
Certainly.
And it has to do with what MJ had to say about the doctors may not be really giving credence to what the parents' worries are.
Mm-hmm.
I taught at UCSD Medical School for 40 years. In the last 12 years of that tenure, I taught a course called the Doctor-Patient Relationship for first-year medical students. They were getting bedside manner from the first week of medical school. And one of the things we emphasized week after week after week in that course was listen to what the patient is saying, and especially if the patient has questions, you don't simply turn off and go on with your agenda. Mm-hmm. But the problem is that physicians don't get reimbursed for counseling.
Yeah.
Or if they do, it's a minimal amount.
Mm-hmm.
And these days, the economics of medical practice are such that they often do not want to spend the time doing that.
Right.
You need to change that.
Right. Exactly. So it's a systemic issue. It's a systemic situation, and the vaccines are one of many of the casualties of that system. And you know, that's just so incestuous and convoluted, because you've got the malpractice insurance, and you have doctors. I mean, it's just crazy how many hours doctors are expected to work. We don't even let bus drivers work that long.
Right.
You know? And yet we give someone a scalpel and have him or her not sleep for 2 days.
Well, a lot better since I started, believe me.
Oh, absolutely. Sure.
Well, and with medications in general, I've worked in doctors' offices. You have just a flood of these, usually women, coming through who are just trying to introduce one drug after the next, you know. And I mean, it's just
a business.
Crazy. Yes. Oh, yes. But it's also a crazy amount, too, of just, you know, how do we expect all our doctors to pull out each pamphlet and read everything, too, you know, when there's so many of them?
That's right.
Absolutely. So then we have to just, you know, revamp the entire medical system.
Please.
But can we do that next Saturday?
I have a list of things we can start with.
I will make you the president, Dr. Goshensky, most definitely.
Very
happy to accept.
So, Em, do you happen to remember what date we have the follow-up scheduled for?
I believe it was the 12th of June.
Yes, I think you're right.
Correct.
Yay!
Okay. Very cool. Well, then with that, you know, I think that I thank you so much, Dr. Goshensky. See, told you.
Just Dr. G.
Hey, I didn't learn how to spell it till the 4th grade. Don't feel bad.
You know, it's because I see the SC C-I-E, and I want to do the Latin pronunciation, and I know that's annoyingly pompous, but
Right.
so I just want to do the Schio. I see it, and I want to say Schio, but it's
Right.
it's
Shen.
not. Shen.
Yeah.
Yes. See, I can only there was my bit of pompousness for the day. Thank you.
I always found that doctors they always have some hard names to pronounce. It's like those little kids have to go through life, like just having to tell their name so many different times. It's like they end up being somebody with a name that people have to pronounce.
I like that idea. I like that thinking. Yes, definitely. Great. So unless there's anything else, I think we can go ahead and stop the broadcast and call it a night, and then we will put the questions, the call for questions out, and see how this goes over.
Well, thank you very much for inviting me to join you. It's been a pleasure.
Thank you. Thank you so much.
And don't leave the hangout. She'll just hit the stop broadcast, and then we'll stay on for a moment.
Okay, so everybody say good night.
Good night.